So in the interest of time, we're going to go on and get started, and we'll continue to allow people to come in. So good evening, and thank you all for joining us for another installment of our Ask a Doctor series, Heart Health Edition. I'm Titania Bailey, president of Arc of Knowledge, Inc. We are a nonprofit organization that provides resources towards building and strengthening relationships between our generation. And as part of our generational health and well-being initiative, we and Centerpoint Baptist Church have the pleasure of partnering with MedStar Health and their team of specialists to provide education and resources that promote better health practices. So before I introduce our speakers, just a few quick reminders to keep your devices muted throughout the presentation, and all questions can be entered into the chat and will be addressed at the end of our session during the Q&A portion. So our presenters for the night are Dr. Brian Case and Sean Cutter. Dr. Brian Case is a board certified and fellowship trained interventional cardiologist. As part of the specialty care provided at MedStar Southern Maryland in Clinton, Dr. Case treats patients with coronary artery disease through modern technological interventions such as intravascular imaging and invasive physiology to help guide stent selection, placement, and deployment. His training includes performing intravascular ultrasound and optical coherence tomography for intravascular imaging, as well as fractional flow reserves and instantaneous wave-free ratios for the evaluation of physiological cardiac ischemia. He also focuses on COVID-19 involvement in the heart, coronary microvascular dysfunction, and healthcare disparities. Sean Cutter is a clinical exercise physiologist at MedStar Southern Maryland Hospital. He holds a master's degree in exercise physiology from Howard University and a bachelor's degree in exercise science from Temple University in Philadelphia. He has certifications through the American Association of Cardiovascular and Pulmonary Rehab, National Strength and Conditioning Association, Titleist Performance Institute, and the American Council on Exercise. He has been designing and implementing exercise programs for individuals for over 35 years in strength and conditioning, as well as pre and post-surgery rehabilitation. He always looks for new training methods to assist with improving performance, counteract injury, and enhancing one's quality of life. Please welcome Dr. Case and Sean Cutter.
All right. Thank you so much.
Thank you.
As always, wonderful introduction and a great job with the terms. So I'm going to share my slide that I have here. So, I'm Dr. Case. I'm an interventional cardiologist. I treat coronary disease and heart attack daily. And then Sean is a MedStar clinical exercise physiologist. And he helps patients who have had heart attacks get back on their feet and better than ever. So our goal is multifactorial tonight. We want to first just talk about knowing the signs and symptoms of cardiovascular disease, the big ones, heart attack and stroke. Know the symptoms, know when to call for help, when to go to the ER. Then we want to talk in detail about identifying risk factors that might lead you to have a heart attack or a stroke, and then how to live a healthy lifestyle, how to prevent these risk factors from occurring. And then, God forbid you were to have a heart attack, what to do afterwards to ensure you live a long, healthy life. And then at the end, we'll have a good Q&A. So, it is Heart Health Month. So, of course, we're going to talk mostly about heart attack, but heart attack and stroke are hand in hand. They are both medical emergencies, and it's important for us to, let people know, let patients know the red alarm symptoms that would require emergent medical evaluation. So, what is a heart attack? It is a disruption in the blood flow of the blood down the coronary arteries. These are the arteries that supply blood flow to the heart so the heart can beat every second. And if there's disruption and an occlusion of one of the blood flow of those arteries, that's what results in a heart attack. The muscle's not getting the blood it needs to pump, and that results in the symptoms of a heart attack. Very, very common. It happens every 40 seconds. What are the signs and symptoms? The classic ones I think we all know are chest pain, usually on the left side, pressure like, sometimes patient will say it feels like an elephant sitting on their chest. It can radiate to the left arm, up the jaw, to the back. Sometimes patients will have associated dizziness, shortness of breath, sweating. Those are all common symptoms. What's important to note is sometimes your symptoms may not be that obvious, and you may still be having a heart attack. This is more important, or we see this more in women, older patients, and then also patients with diabetes, high blood sugar. Sometimes their symptoms may be a little bit more subtle. They might just be having heartburn, so like reflux-like symptoms that they might think is related to food. It could actually be their heart. They might feel just fatigued or tired. They might feel dizzy, might feel nausea or vomiting, or they could even just have like chills and feel cold. These subtle signs, if you do, so say like you think it's heartburn and you take like a Pepcid or a Tums at home, and that doesn't give you relief that you're expecting, you might be it might be your heart, and it might warrant you to get evaluation sooner than later. So those are the signs and symptoms of a heart attack. And the important thing about a heart attack is if you're having the classic symptoms or you're concerned that you might be having, some of the atypical symptoms, don't sit on your symptoms, meaning don't wait. Don't wait. Oh, let me sleep tonight and see if it gets better tomorrow. Let me go to work and see if I walk around a little bit, it'll get better. In the cardiology world, we always talk about how time is muscle, meaning if there is a blockage, the sooner we can get to that blockage, the better you're going to do long term. So every second counts, really. And our goal is to always get patients, when a patient does come to the ER, our goal is to get that heart attack treated as soon as possible. But in order for us to treat that heart attack as soon as possible, we need you to come into the emergency room. So please, please, please don't ignore your symptoms. So what's a stroke? Just like with the heart, there's blood vessels that supply blood to the brain. If there's a disruption in the blood flow going to the brain, that can lead to the symptoms of a stroke. Essentially, the blood is not getting oxygen and the nutrients it needs to function. And if you wait too long, that area of the brain could be permanently damaged. Just like with a heart attack, a stroke happens every 40 seconds in the United States. What are the signs and symptoms of a stroke? The big ones are change in vision, trouble speaking, or loss or movement of your face, hands, or feet. And it's typically asymmetric, meaning one side or the other. Like all of a sudden, your right face will droop down, or you can't move your left arm, or you can't lift up your right leg. That kind of like one-sided weakness, focal, like immediate out of the blue weakness is concerning for a stroke. Just like with a heart attack, we can fix it. We can give medications, or we can do an intervention to relieve the blockage, and we try to do that as soon as possible. But just like with a heart attack, we can't help you unless you call EMS or you call the ambulance or you come to the emergency room. So again, if you're having these types of symptoms, please, please, please don't ignore them. Come see us right away. So that's what a heart attack and a stroke are. Sean, I don't know if you want to add anything from your perspective so far.
No, not at all, doctor.
All right, excellent.
Killing it.
So now that we know what a stroke and a heart attack is, how do we prevent this from happening? And the key thing is identifying risk factors. Unfortunately, there's some, and we divide risk factors two ways: modifiable risk factors and non-modifiable risk factors. Non-modifiable risk factors are things that we can't control, we can't change. We can't change our age. We all want to be younger, but time is time. We can't change our parents, so our genes, where our genes are our genes, and sometimes you're more at risk for certain disease process than your neighbor, and that just has to do with your genes. We can't control our gender. Sometimes gender has an impact on certain disease processes. And then lastly, race. Race actually has a impact as well. There's a lot of data to demonstrate that African Americans have a higher rate of cardiovascular disease and the risk factors associated with it. So those are our non-modifiable risk factors. But the good thing is there's a lot of modifiable risk factors. There's a lot of things that we can screen for, we can treat, we can target, and we can bring all of those problems down or control those to prevent us from having a stroke or a heart attack. So I want to spend a little bit of time just going through those now. First and foremost, without a doubt, high blood pressure, hypertension. If your blood pressure is too high, your heart has to work harder to push blood flow all around the body, and that can lead to problems with the heart overall, and it also puts you at an increased risk for having heart attacks. It could also cause you to have strokes, also can cause you to have kidney problems, liver problems, a whole slew of things. Hypertension is very, very prevalent. And the problem with hypertension is we call it, and this is kind of a bad term, the silent killer. And that we say that because patients can live with hypertension for years and years and years. They don't know they have it. And over those years, it's doing damage to the organs in the body, and the patient doesn't even know it. So it's important to screen for hypertension. How do we screen for hypertension? Just a good old blood pressure cuff. Get it done at your doctor's office. The grocery store has the one you can do also. Wherever you see one, you should, just stick your arm in and do a quick blood pressure check. What's abnormal? Well, what's normal, I should say. Normal is 120/80, but that's a range. And the range for us for a systolic blood pressure is between 100 and 140. That's the top number, systolic blood pressure. The bottom number, the diastolic blood pressure, should range from of about 60 to 90. If either of those numbers are above, as you can see here to the right, so like 140/90, if they're above, and they're above consistently with multiple blood pressure checks, you might have hypertension, and it would be important to get evaluated by a primary care doctor or cardiologist to treat that blood pressure. So that's the first one. Second identifiable modifiable risk factor is high cholesterol. So what is cholesterol? It's fat-like substance in the blood that comes from our diet that is the part that builds up plaque in the blood vessels. This is what causes blockages in the heart and in the brain. So if you can minimize the amount of cholesterol in your body, that will minimize the amount of chances or risks that you could develop plaque in the blood vessels. There's different types of cholesterol. We try to minimize bad cholesterol, and we try to enhance good cholesterol. And we can do things with our diet and exercise to improve this balance. And then there's also, of course, medications we can prescribe patients to ensure their cholesterol is adequately controlled. The third thing is diabetes, or high blood sugar. Diabetes is a systemic disease where a patient inappropriately, metabolizes blood sugar, resulting in more blood sugar in the blood, and that blood sugar can deposit in a lot of different organs in the body, such as the brain, the eyes, the heart, the kidneys, the feet, the legs, and it can cause multitude of different types of medical problems. And just like with high cholesterol and high blood pressure, sometimes a patient could have high blood sugar for a long time and they don't even know it. So it's, again, important to screen for it when you can. It's also very common. It's about 1 in 4 adults have diabetes and they don't even know it. And it impacts about 30 million adults in the US at any time. And that number is only going up, folks, unfortunately. Due to, the American diet, we're spending more time on the computer and on our phones, being more sedentary. Unfortunately, the rate of diabetes is going up in the United States. So it's important to look for it. It can be silent at first, but then it does manifest with symptoms. So if you have any of these symptoms, that you should be thinking about maybe you're getting screened for diabetes. The way diabetes works, it actually creates increased thirst. You actually are more thirsty than usual, and it can actually make you feel more hungry, which is interesting. So increased thirst, increased hunger, going to the bathroom more frequently, blurred vision, and then also the big thing is if you start to develop numbness in your feet. So if both your feet start to be numb, or your toes, or your fingers, or if you cut yourself, it takes a while to heal. Those can all be small indications that you might have diabetes, and it would be worth screening. And on the right, you can see it impacts a lot of different parts of the body. So how do we prevent high blood pressure from happening or controlling it, diabetes, and high cholesterol? Living a healthy lifestyle is key, and these can all alter these modifiable risk factors. This is a nice 7 steps to a healthier heart. This is from the AHA, and we'll go one by one and talk about how we can modify these risk factors. The first one is smoking. Smoking is so bad for the heart and for the lungs, the brain. It could cause cancer, but specifically for the heart, smoking causes 1 out of 4 deaths from heart and vascular disease. So if you are smoking, you are putting yourself at an extremely high risk for damaging the blood vessels in the heart and putting you at an increased risk for a heart attack. So it's easy to say, I know, but if you can stop smoking, you're going to decrease that risk of having heart disease by 10-fold. And if you need help with quitting, reach out to your primary care doctor, reach out to your cardiologist. They have certain medications, the gum patch to help you quit. So that's number one. And I know it's easier said than done, but doing that would have a dramatic impact on your heart health. The second is physical activity.
Yes.
I'm gonna let Sean weigh in on this one now. Go ahead, Sean.
Yes, well, the more activity, the better. Obviously, exercise is a form of medication. Supports strengthening the heart, improving circulation, self-esteem, mood. It promotes better sleeping patterns, decreases the need for medications in some of the cases. It helps to manage weight. Also, blood sugar, blood pressure, blood cholesterol levels. Again, exercise, I look at it as a medicine, a form of medication. So,
and Sean, when what should we tell patients when how much exercise is enough exercise in a week? Like, what should everyone be running a marathon or what?
No, not at all. It's all dependent on age, on risk factors, on abilities. We generally say 150 minutes of aerobic exercise or exercise per week is sufficient or effective for maintaining, if not decreasing, the risk of cardiovascular disease and or factors therefore involved. Hypertension, diabetes, cholesterol, but 150 minutes bare minimum. And that can be a combination of aerobic exercise, lifting weights, simple exercises, moderate exercise, simple as like gardening or dancing, or there are several variations, brisk walks. The majority of our clients and patients, after they leave our facility or cardiac rehab, they are very comfortable at managing their exercise programs on their own and moving. The key is movement. Again, if you can't walk, maybe it's swimming. If it's not swimming, maybe it's dancing around the house. Maybe it's doing some gardening. All of these things continue to assist with keeping the vessels in a more dilated or relaxed state and keeping heart rate and breathing frequency down, reducing the risks of heart and lung issues. Does that help?
Yeah, absolutely. And yeah, I tell my patients, even walking around the neighborhood to start, even that alone will do such wonders for you. And then you slowly just build on it and gradually improve your movement. So thank
Exactly.
you.
And if I can jump in for 1 sec, I'll
Absolutely.
say, yeah, even if you're starting with 5 minutes of walking, but we build it up to where you're doing 5 sets of 5 minutes throughout that day. Everybody starts somewhere. The key is to have gradual progression. And again, in a professional setting under Dr. Case, and then coming to see someone like myself in rehab, that we have certain protocols and certain ways of making sure that not only the safety and effectiveness of teaching you how to train and be in a zone or in an intensity that's going to be effective and not put you at risk. In the long run, the key is to keep you out of having a second surgery and or any other heart or lung issues, and working through cardiac rehab. That statistics show that we're going to reduce the likelihood of you having to come back for any. I'm sorry.
Yeah, I think it was just somebody.
So reducing the likelihood of having to come back in for a second heart attack or another heart condition or God forbid any other issue regarding the hearts or lungs.
Yeah, great. Thank you, Sean. Really appreciate it.
Sure.
And this is exactly what Sean said. So yeah, like you said, even just dancing, gardening, household chores, and vacuuming can all help. So that's exercise. But I think Sean would agree with me. The other half of it is certainly diet, right? You could be exercising all the
Correct.
time, but if you're
Correct.
eating fast food every night, then it's negating itself.
Correct.
So there's there's multiple different diets out there. Some good, some bad, fad diets. What I can tell you is these are the best proven medical diets out there, heart healthy diets. And what I mean medical proven, I mean these have been tested in clinical research, cardiovascular clinical trials. So there's a lot of great diets out there, but this is what I recommend for my heart patients. I say the Mediterranean diet, and I say Mediterranean diet because it's usually easy for people to identify with and understand. So fish, chicken, olive oil, vegetables, fruits, nuts, grains, and actually, which is I guess good, a little bit of wine is actually beneficial as well. Obviously moderation, but then you can see in the middle there's an overlap. Vegetarians is a very healthy lifestyle, but again it incorporates those nuts, those grains, those fish, nuts, grains, vegetables, and fruit. And then there's the DASH diet, where you can see from the right. DASH diet was specifically a medical diet that was created to address treating hypertension. But again, there's a lot of overlap with the Mediterranean diet. And the common theme: fruits, vegetables, nuts, grains, fish, chicken, olive oil, staying away from a lot of red meats. And you can see down here, that's what they recommend. Cut back of processed meats, red meat, avoid trans fat. You can look that up on the packaging. And then a big thing is drink water or juice instead of soda. you'd be amazed to see how much sugar is in soda, and how much that can, impact your weight, um, uh, put you at an increased risk for diabetes as well. So those are the kind of 7 steps to a healthier heart. I think the big ones are smoking, avoid smoking, exercising, as Sean laid out,
Yes.
improving your diet, the kind of thinking of the Mediterranean diet. And then as you can see on the bottom is screening. Get that physical, check your blood pressure, check your cholesterol, check your blood sugar, and make sure they're all well controlled. If they're not, we can help you by giving you recommendations for lifestyle changes, or if we're at the level where we need to start medications, we'll start medication. And then also what Sean said, if you're exercising, that also helps with lowering your stress levels as well. So that's key. So last part before the Q&A. You've had a heart attack, or you've had a family member that has had a heart attack. What now? First and foremost, relax. You did the right thing. You came in soon. You came in early. We treated you. If you are taking your medications, follow up with your primary care doctor, your cardiologist. There's no reason why, you can't just live a long, healthy life, just like before the heart attack. And we'll go through some steps here. So when we're talking about all those before, we're talking about primary prevention. Now we're talking about secondary prevention. You've had a heart attack. We're going to do everything possible for you to live a symptom-free life. And then also the biggest thing is for you not to have another heart attack. Unfortunately, if you had a heart attack, you are increased risk for having another heart attack. But now with all modern medicine and cardiac rehab and things like that, we can decrease that risk a lot. So the biggest thing is please be compliant with your medications. Take your medications. Understand your medications. Know why you're taking them. Have them clearly printed out or on your phone in a list. If you need to make a schedule, when to take them. If you need a pill box, please make that extra effort. Modern medicine is fantastic, but unfortunately with modern medicine and all the great meds we have is a lot of the heart patients are on a lot of medications. So it can get confusing. I'm not denying that at all. But you could do small things like making a checklist or having a pill box to help remember to take all your medications. If you're confused about anything, or you are worried about side effects, or you want clarification, that's where it's going to be important to routinely follow up with your primary care doctor and also your cardiologist. The perfect way to do it is staggered. So you see your cardiologist every 6 months and you see your primary care doctor every 6 months, but then that gap in between is only 3 months. And that just ensures that you're seeing a healthcare professional, and we're double checking your blood pressure again. We're making sure you're on all the right meds and you're doing great. The second is follow your care plan. And the care plan is all those lifestyle modifications we just spoke about. When you have had a heart attack and you're in the hospital, a lot of people are throwing a lot of things at you all at once, and it could be overwhelming. But just remember what we talked about tonight. Eating healthy, exercise, not smoking, screening for all these risk factors, and then taking your medications like you're supposed to. Ask for support. I think this is key. It takes a village to really manage a patient with cardiac disease. So lean on your loved one, lean on your parents, lean on your children, lean on your grandchildren, lean on your neighbor, people in your community, to hold you accountable. But then also, start a program, start a group, walk together, or do like a weight loss challenge where 20 of you try to lose weight for a month and see who can lose the most. Or if in your household 2 or 3 people are smoking and you've just had a heart attack, that's the best reason for everyone in your heart to stop smoking. Those kind of support groups will go a long way. And then also, also if there are online support groups as well that can help if you've had a heart attack. The next thing is have an emergency plan in place. So if you were to have another problem, or you were worried about having a problem and you had to go back to the emergency room, it is good to have that list of medications like I talked about. So the doctor treating you can easily see and understand, what your medical conditions are and what they can do to help you if needed. Now, this last one, I feel very, very strongly about, and then I'm going to give my 2 cents and then I'll kick it over to Sean. So cardiac rehab is recommended for every patient that has had a heart attack and has been proven to be beneficial for patients for symptom relief and then also for preventing another heart attack from happening. In my clinical practice, I have never met a patient who has had a heart attack and then has enrolled in cardiac rehab who didn't like it. They all like it. So in my opinion, every patient who's had a heart attack should be enrolled in cardiac rehab. But I'm now going to kick it to Sean so he can let us know what cardiac rehab is specifically and why it's beneficial for patients.
Sure. Thank you, Dr. Case. All right. So most insurance companies and Medicare will cover up to 12 weeks of cardiac rehab with a total of 36 sessions. So it works out to be about 3 one-hour sessions a week for about 3 months. Benefits of cardiac rehab: they help to recover and get stronger after heart attack, heart surgery, or heart issues. Help to get the body moving, get stronger, get back to doing everyday activities and with ease. Improve your quality of life. Decrease risks of having another heart attack, as we spoke about earlier. During our programs, the 5 major components are the exercise training. We discuss cardiac risk factors and changes, how to address those, if it's diet, if it's smoking cessation. We educate on the heart, the different areas and conditions and what you may be dealing with. We talk and work on diet and nutritional counseling. We also assist with emotional support. A lot of times after a heart attack or any condition, we're feeling a little uneasy and we need some people that we can relate to. So there's also those camaraderies there as well. People meet others who've had similarities and are continuing to build their health. And as Dr. Case was speaking, they end up joining groups. We also have what we call a phase 3. Once they finish with us, they can continue on, but not under such a supervised setting, but they're still able to see us and get vital signs and have professionals there if needed. Goodness, I mean, I can go on and on about cardiac rehab. I think the big piece is statistically, it enhances the longevity of life. It also enhances quality of life. And here at MedStar, we're working to keep people alive and well. So
now, Sean, I get this question a lot. Are there like 1 or 2 in this area, or is there multiple? Like, can we? Because sometimes patients come from pretty far away. Is there a lot of locations?
There are. I would say there are. MedStar, we have 2 or 3 here. We have one down at St. Mary's. We have one at Washington Hospital Center, and then we have ours here at Southern Maryland, as well as Georgetown. Excuse me. So those are our 4 major cardiac rehabs. There are others that we, send individuals to if needed, for sure. But those are the major ones that we use. That's our hub.
Great. Great. And yeah, I really want to stress, I've never met a patient who doesn't like cardiac rehab. It's incredible. It just gets patients back on their feet, moving quickly, that support group, and it just gets them kickstarted, back to a healthy lifestyle. And to be honest with you, I would argue that some of my patients who have had heart attacks are healthier after their heart attack than before their heart attack.
I was
They've
gonna
had
say,
that,
new life, a new
yeah, they have a
life.
new life. They're, they've had that scare, and
Yeah.
they're exercising more, they're eating healthy, they're controlling all those risk factors as well. So that's what we have. I hope that was helpful. But I think the most important part of this session is always the Q&A at the end. So please, 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 we welcome all and any questions you may have through the group chat, via Zoom, whatever's best for you guys.
Okay. I see a question from Eddie. He says, what happens at a typical rehab session?
Typical rehab session, Eddie, is exercise, education, and mobility work. It's an hour-long session. You come in, we hook you up to our telemetry. We at that point we get some resting vitals, and then you're off to the races. As always, there's always a gradual warm up and a cool down, as well as aerobic exercise, and depending on where you are, if you've had an open heart surgery, there might be some restrictions, or there may be other restrictions, but weightlifting as well. We are not physical therapy by no means. We're here to help the heart and the lungs. So I hope that helps.
Yeah, that was a great question too, for sure.
I have another, Dr. Case. There's a question saying, what are some common misconceptions about heart health?
I think a very common misconception about heart health is cardiovascular disease is a disease of men. You know, there is a lot of data to suggest that coronary artery disease can impact women just as much as men. And then more importantly, there's data to suggest that women can have poorer outcomes than men if not treated in the same manner that a man would be treated. And I think that goes back to what I said at the beginning, where sometimes the presentation of somebody having a heart attack can be different or atypical. And we see that a lot in women. That's when I was talking about patients feeling fatigued, or tired, or just having reflux, or just having nausea and vomiting. And I think sometimes, women will have the symptoms for longer than what we would desire. And they might not think anything of it because it's not the classic, symptoms of having a heart attack. Or they might go see the primary care doctor, and their primary care doctor thinks, oh, you're probably just having reflux. It doesn't sound like a heart attack. So that's probably my biggest, I would say the biggest misconception for sure. The second is, prevention. There's so much we can do to prevent cardiovascular heart disease. It's still the #1 killer in the United States, but like I laid out before, there's so many modifiable risk factors that we can change. We just have to, do our job to screen for all these disease processes.
Thank you. I have a question in the chat from Joy. It says, thank you, doctors, for your great presentation. How much sodium should one consume?
I'm just curious, Sean, do you have an answer for this? Like, do you guys say anything at cardiac rehab or?
Under 1,500 milligrams,
Yeah.
but goodness,
Yeah.
that's very hard to manage.
Yeah.
So
yeah, exactly. So I say the same thing, but I'm realistic. It's impossible not to have salt in your diet. I mean, let's be honest. It's everywhere, especially in the United States. But what we can do is we can control it in moderation. So avoiding putting, salt on top of whatever you're eating. And then also trying to avoid food that has high salt content. And what is that? Unfortunately, that's all the bad
that's
stuff
about
that we like.
everything.
Yeah.
Yeah.
Yeah, so fast food, like frozen dinners, processed meat, canned food, all like pre-made food. Unfortunately, that's all has high salt content. If you can, get fresh fruit, fresh vegetables, fresh meat, you're going to be avoiding your overall salt content. And I see the next question. I'll just take it since we're talking about salt. Do athletes need more sodium? Short answer is no. No. You know, athletes need to be hydrated, and that's it's just probably done through, you know, water and then other drinks. But direct increase of salt is not beneficial for athletes.
Right, I have Sylvia is asking, can you speak about the use of magnesium and heart disease prevention?
Yeah, that's a great question. There isn't a lot of medical data or evidence to support, you know, over-the-counter herbal supplementation with magnesium. There are some heart disease processes where magnesium actually helps, but that's really when we're dealing with the electricity of the heart. Sometimes you can be in a abnormal heart rhythm, and magnesium can help with that. That being said, I think overall, proper nutrients or electrolytes, including magnesium, is important and doesn't play a part in having a healthy heart. But you know, magnesium specifically as a supplement to prevent heart disease, unfortunately, that data isn't necessarily out there right now.
Next question in the chat, is there any correlation between untreated anemia and heart disease?
Yeah, no, this is a great question. So anemia is certainly a broad term. You know, anemia can be like a little bit of anemia, so a little bit of a low blood count, or you can have really, really low blood count and be anemic and be like very symptomatic from it. Anemia in of itself is not a true direct correlation to heart disease or cardiovascular disease. That being said, when you have a low blood count, your heart has to work harder to pump blood, and that inadvertently can result in heart disease, and could cause problems with your heart. Not necessarily always a heart attack, a blockage, but it could create issues like the clinical syndrome heart failure, or can cause, again, issues with your rhythm, your heart. So, you know, it's not good to be anemic, and certainly the heart is a bystander of that for sure. So if you do have anemia or low blood count, certainly, and it's due to, you know, low iron, it is important to take iron to get those blood counts back up, so the heart and all the other organs in the body are getting the proper nutrients that they need.
Thank you. The next question is, we know that stress affects heart health. What are some strategies for managing stress?
Sean, do you want to take this one?
Sure. Some of the things, again, that I think are very beneficial are assisting with reducing sympathetic nervous system reactivity. We like to use yoga, meditation, soft, relaxing music, things that are going to help, again, reduce breathing frequency, ease the mind. Those are the most beneficial ones, in my opinion. Yoga, Tai Chi, calming musics, the ripple effect of the water, you know, the rocks on the water, things like that help to reduce.
Yeah, definitely. I think the only thing I would add too, and I always tell my patient, is sleep hygiene. Sleep is important.
Yeah.
You know, you need to get 7 hours of sleep a night. minimum. And if you don't, it kind of compounds on each other, and that definitely will result in your overall increased stress. And the key part of that too is, ensuring or getting screened for sleep apnea. So sleep apnea, there's a lot of overlap between heart disease and those risk factors and sleep apnea. Sleep apnea is when you have these brief moments where you stop breathing at night, and it interrupts your sleep cycle, and you don't get the full, you don't get regenerate, you don't get the full sleep that you need when you have sleep apnea. So also, want to make sure you have good sleep hygiene to help reduce stress also.
Are there any natural remedies to lower elevated cholesterol?
Yeah, no, that's a great question, Snor. So certainly what we talked about will demonstrate lowering cholesterol. So that again goes with the Mediterranean diet and then also exercise. All those things we talked about, especially like the olive oil, the fish, the chicken, the nuts, the grains of fruit, that's all going to help with having good cholesterol. Also, avoiding heavy use of alcohol. We didn't talk about this before, but binge drinking or drinking more than a glass of wine a night can also drive up your cholesterol. There are over-the-counter cholesterol lowering supplements. I won't go into detail about all of them, but there is data to suggest that they can help with lowering your cholesterol also. But I would recommend, if you have high cholesterol, do the lifestyle modifications we talked about. If the lifestyle modifications aren't working, your cholesterol is just high because it's high because of your genes. Raising my hands up, I'm one of those people. Don't go to the supplements next. If your cholesterol is high and you're doing everything right, go to your primary care doctor, go to your cardiologist, get on the medications that are proven to be medically beneficial for you. I'm sure we all have heard about statins. Those are the main medications to lower your cholesterol. Statins are one of the best medical medications that have ever been invented. They are very effective in preventing strokes and heart attacks. So if you qualify for a statin, you should be on a statin, not on like a over-the-counter supplement that might have some benefit for you.
I have a question from Jackie. Could bedridden patients participate in cardiac rehab?
This is a great question. I don't even know the answer to this. Sean, go ahead.
Bedridden in our facility, unfortunately not at this time. I think a phase one, when they're still in the hospital, dealing with a heart issue, normally it's a physical therapist or one of our respiratory folks see them. Occasionally, one of our exercise physiologists go up, but again, that's only for a day or two. Perhaps down the road, you could work out something virtually and an exercise physiologist would be able to assist you. But at this time, you need to be able to ambulate. If you come in on day one, there's a 6-minute walk test or an assessment period. And then at the end of your 12 weeks as well, we do an assessment. And part of that is based on how far you can move or basically oxygen consumption, and which equates to a metabolic equivalent. So the higher your energy levels are, the better off you're going to be in the long run.
Yeah, I would make one comment that there is some companies out there where they will bring a bike or a device to your house, and you could do cardiac rehab in your house.
Yes.
If you have trouble with transportation, or you have little kids at home and you just can't leave them, they'll bring like a bike, and there'll be a screen like an iPad, and you'll be one-to-one with an instructor. So if you have limitations like that, we can prescribe that for you, and you can still get the benefits of cardiac rehab. Right, Sean? I mean,
yes, definitely.
yeah, it's I've done it a few times for my patients, and it's worked well. I mean, I'd rather you see Sean for sure, of course. But if not, then it's a good alternative for sure.
What are some resources, websites you recommend for additional information?
Yeah, I mean, for me personally, I got a lot of these slides from um, the American College of Cardiology, ACC. You can just Google it, or American Heart Association, AHA. There's a whole section specifically for patients with no medical terms, and really a step-by-step guide of how to live a healthy heart life.
Do you think the use of health coaches are beneficial to reducing additional heart attacks for cardiac rehab patients?
Oh, most definitely. It helps in so many different ways, from keeping an individual, having the support, first of all, the emotional support, a structured ritual or routine where they need to be there. Again, building camaraderie. There are so many avenues that having a structure or a coach, the discipline behind it is going to be beneficial. Again, working with individuals like ourselves, we're looking for progression. Obviously, there may be some regression initially, but the goal is progression to help you move and feel better in the long run. And over that 12-week period, again, as Dr. Case and I have said, most individuals leave there skipping or feeling a lot better, than when they came in. So movement is the answer, in my opinion.
Okay, and then I have another question that came in to me. It's regarding bypass surgery. What lifestyle changes are recommended post bypass surgery to maintain heart health? I noticed that most people fall back into previous habits after having surgeries like these.
Yeah, I think everything we've said so far is the same for bypass surgery patients. In the old days when you had surgery, you would stay in bed for like 2 weeks and try to recover, but that doesn't happen anymore. The day after you've had bypass surgery in the hospital, you're up and walking around the hallways. And we want the same thing, you to move and everything like that. The only restriction for bypass surgery patients is for about the first, and Sean could probably comment too, is the first 6 weeks or so, when the bone, the chest wall that opened up is healing. So there are a little bit of restrictions, like you can't, bench press or anything like that. But otherwise, we want you, just like we've been talking about, up and moving and being active. Sean, do you want to say it from your perspective?
Yeah, correct. Not generally, about 6 weeks, 6 to 12 weeks, but the legs and the aerobic exercise can be done. It's just working within that barrel or that box, we like to say, not using the extremities or stretching the pecs or anything that would create additional issues. Again, they're looking at the incision site. Everybody's different. It has to be healed and have the go ahead from the doctor before we get to doing any of that.
What's happening here? Okay. All right. I don't have any more questions. Do any of you all have any other questions that we'd like to share before we close out this evening? Please feel free to take yourselves off mute and ask any questions if you'd like. All right. Well, thank you, Dr. Case, Mr. Cutter, for your insightful and comprehensive presentation focused on heart health. We hope that all of you found this presentation helpful. And as always, a big thank you to the MedStar team and our community partners for your collaboration on this important initiative, and thank each of you for joining us. Of course, to see a replay of tonight's session or any of the Ask a Doc sessions, visit either MedStar or Archimnologist Facebook and YouTube pages. We hope that you'll join us next month for another installment of our Ask a Doc, where we will ask the sleep expert. That information is also in the chat. And again, thank you all for joining us and enjoy your evening.
All right. Thank you, everyone.
Thank you. Good night.
Bye.
Ms. Henderson? Unfortunately, the meeting just ended. You can always go to arcofknowledge.org, our website, and check for the next meeting, which will be next month on March 22nd, I believe.
28th,
March 28th.
but the presentations are at 6.
Yes, and the presentation will begin at 6 p.m.
Is it still recording?